Are you suffering with knee pain and looking for some things that you can do at home, some massage techniques that will help to decrease the pressure on your knee and eliminate your knee pain? Then you are in the correct place. So I am in the middle of dopey training, which is 4 races over 4 days, totaling 48.6 miles. You'd be shocked to hear that I have some tension in my muscles as well as some knee pain. So I'm going to walk you through the techniques that I use to decrease my knee pain, especially after a long run. Now you may be saying to yourself, Dr. Amy, I am not a runner. Will these techniques work for me? Yes, if you are suffering with knee pain, and particularly if you have tight muscles associated with that knee pain, this video is going to be very helpful for you. You see, when you have tight muscles, it actually causes poor tracking of the knee. It can cause the kneecap to not be able to glide correctly. It can cause compression of the thigh bone on the shin bone, and this can lead to cartilage issues, which is arthritis issues. You can create all these other problems just because of muscle tension. So doing these self-massage techniques can help to decrease the muscle tension, decrease the compression, and decrease your symptoms overall. Because remember, every tissue in your body is designed to heal itself as long as it's moving correctly. If you're suffering with knee pain due to any reason, it may be overuse because you've been running too far, it may be an injury while you were doing your activity, or it could even be arthritis pain. These tips are going to be very helpful to not only help to decrease your pain, but allow your body to heal naturally. All right, first, let's talk about what we're going to use for the massage. Now, you can use your hands, and I will show you some techniques for that. Using the hands are a little bit more difficult when it comes to certain areas of the body, so it's not necessarily my preferred technique when I'm doing self-massage. Obviously, that's what I do for my patients in the clinic, but it's way easier to get leverage when I have them on a table. So the first thing you could try using is a racquetball. Racquetballs are really nice because they're really firm, but they're small enough that they can kind of get into those knotty areas. So I love using a racquetball for self-massage. Now, if you want to up your game a little bit, then what I use at home is the stick. This is an old school technique. They used to be popular probably 20, 30 years ago. I don't know, it was like way back when I started running. They became all the rage and everybody was using a stick before the race and everything like that. You don't commonly see them around as much anymore, but it's still one of my favorite tools, and especially when I'm dealing with the legs because you have those longer muscles and I feel like you can cover a lot of territory pretty quickly. Now, some people will ask me, can I use like one of the massage guns? And sure, that's definitely okay to use as well. If you're going to use a massage gun, I highly recommend the Theragun. I really like the way they have it designed. It's very easy to hold with your wrist, get some good pressure, especially when you're talking about your legs. Some of the other guns have some weird wrist motions that you have to do to get different areas on your legs, so I don't feel like they're as ergonomic, especially when you're dealing with your hands and your wrists. The one thing I am going to ask you not to use is a foam roller. And I know that many people on the interwebs recommend using a foam roller, particularly for your legs. However, I feel like that causes an excessive amount of compression, as well as makes it difficult to keep your spine in a neutral position. We don't want to put our spine in an abnormal position in order to be doing some massage because that could cause other problems later on. So I don't recommend using a foam roller when you're trying to massage your legs. Ready to get started? First up is the quads. All right, so first off, we're going to do the quads. Like I said, I like to use the racquetball a lot. So what you can do is just massage it up and down, and I'll kind of find those areas that are really knotty. Let me find a good one in there, like there. And then I'll just kind of roll it down, putting palm pressure. So I put the palm pressure down, especially when I'm doing my quads, because I can get enough pressure, and that feels like I'm getting a good release through there. However, as I mentioned, my favorite thing to use is the stick, and particularly on the quads, because you can get all the way through those long muscles and you can go up and down and really get through the entire muscle belly into the tendons. Now, with the stick, if you still find that tight area, let me find that same tight area. Yep, right there. You can do a little bit of back and forth if you feel like there's a big knot, or you could do the stick for the entire muscle and then go ahead and use the racquetball for those more specific locations. If you're going to use your hands, then I like to do, again, along that muscle belly and going down like that. Now, if I were going to use my hands, I probably would do that on my skin, but I don't like to use the roller on my skin because it can kind of get a little grabby sometimes. I prefer to do the roller over pants. Everybody's different, so do what works best for you and your body. However, if I was going to do some quad massage with my hands, I probably would do that with shorts on so I could get directly on the skin. Now, whether I'm doing it over clothes or I'm doing it in shorts, I don't like to use lotion when I'm using my hands. I don't do it in the clinic, and I often don't do it when I'm doing my own self-massage. The reason why is I don't want so much that gliding or that surface level contact, but I want to be able to get deeper down in there, which I can do better if I don't have that lotion. Now, again, if you feel like more of that gliding motion is more helpful for you as opposed to that deeper motion, and you feel like using lotion is going to be better, that's fine. It's just not my preferred technique, but if it works better for you, then that's what you should do. So now we're going to do the hamstrings. So if I'm going to do the hamstrings, commonly with the ball, I'd either do it in a wider, deeper seat, or you could even do it on the ground. But for right now, I'll show you on this seat here. So I'm going to put the ball underneath my hamstring. So not underneath my butt, but underneath my hamstring. So that's the muscle that goes from my buttocks down to my knee. And like there's a nice spot right there where my hamstring is sitting on top of that ball. Now, obviously this seat is not super deep, so I don't have a lot of motion here, but what I can do is just kind of wiggle that leg back and forth. And let me tell you, that is a super nice trigger point release. So I definitely feel that releasing really well with the racquetball. But again, for the hamstrings, the stick wins again because you can get those nice long muscles. And when you're doing this, you can perch more on the edge of your seat and you can roll back and forth. Again, covering the entire muscle belly and finding those tender spots. And if you find one, there's that one I was just working on right there, you can go back and forth a little bit. Now, I don't know if you can see it from that angle exactly, but the stick does bend just a little bit. Let's see if I can show you here. There's a little bit of bend to it, so it really does help to kind of conform a little bit to the muscle. Now, this bend is fantastic for legs. However, I don't recommend the stick for like the upper body where you have more bony prominences and it doesn't have enough bend to conform to most of the muscles in the upper body. But for the legs, the stick is the winner for me. If you're interested in using your hands for your hamstrings, I like to use my fingers, keeping my thumbs over my quads or over the top of my thigh, more in the front there. And I'll do, again, that long stroke down. Again, if you find a particular area that's tender, you can kind of go back and forth and wiggle over it. But I'll do more of that long type stroke when I'm doing the hamstrings. The next muscle that's up is the adductors. So the adductors are the muscles that are on the inside of your thigh. If you try to do the butterfly stretch, so you're laying on your back, feet together, knees go out, you're actually stretching those adductors. And ladies, for you, I can guarantee you, your adductors are probably tight because most women's are. So it's really important to make sure that we address those adductors. Again, with the ball, you can do a nice long stroke all the way through. Or you can find a particular area that feels tender, trying to find a good spot here. There we go. And then really focus in with the ball. Now, you want to be careful how much pressure you put through here because these adductors are actually more tender than most people realize. Our quads and our hamstrings are usually used to getting pretty beat up, but those adductors can get really tender really quick. So do be careful with how much pressure you're putting through that racquetball. Again, the stick is my favorite, even for the adductors, because it's easy to get here all the way through those adductors without putting too much pressure on my low back, on my hips. I don't have an awkward posture or anything that's going on. You can grab from the other side. If you do this, this will bring a little bit more pressure through there. Yeah, that's getting it pretty well right there. And I'm not having to compromise another area of my low back. So the stick wins for the adductors too. Now, if you want to use your hands for the adductors, I'm not going to use the same hand because I feel like that's difficult to get across my body. I'm going to use the opposite hand. So for right leg, I'm going to use left hand. I'm going to use more of my palm to push down and really stretch through those adductors. Now, I find it harder to get more of that long stroke through the adductors. But what I'll do is kind of grab the adductor and stretch it down. Grab the adductor and stretch it down. Now again, if you find those really tender spots, so there's a good one right there. Then I'm going to use some fingers, particularly on that trigger point type of area. Some people like to put the fingers on the trigger point and then shorten the muscle. So for adductors, that's going to be bringing that knee towards that other knee, and then that will help to shorten it. That can help to release that trigger point a little bit easier. So it would be fingers for the trigger point or the really hyper irritable part of the muscle, but I prefer to use the palm of my opposite hand to really get through that muscle belly. So we did the front, we did the back, we did the inside. Do we do the outside? Now here is the controversial question of what do you do about your IT band? Many people are aware that their IT band, that thick piece of fascia, is on the outside of their leg. And when you massage it, it tends to get really irritated. A lot of people really like to use that foam roller on that IT band. I find that that's a lot of pain without a lot of gain. So what will I do for the IT band? Well, if you've watched any of my other videos, you know that I don't like to treat the IT band directly. Instead, I like to treat the gluteus medius, which is the muscle that's up at the top of the hip that the IT band originates from. You see, the muscles have a lot of blood supply. And when you have a lot of blood supply, that can bring the healing nutrients that are needed, as opposed to the IT band, which is fascia, which does not have great direct blood supply. So if you do something like a foam roller, that does create some trauma and maybe even some stretch, but that stretch usually comes at the cost of having damage. And if you don't have great blood supply, then it's not going to heal, which will leave you in a chronic state of iliotibial band syndrome. That's why I like to treat the gluteus medius. Now, to do this one, the stick in general will not win for me because now we're talking about more of a bony area and a smaller muscle. So I like to use the racquetball on the wall. Okay, so for the gluteus medius, you're going to take your ball and you're going to put it over that gluteus medius. So this is my hip bone, so my hand is on my hip bone. The gluteus medius is right underneath that hip bone. So top of the hip bone, bottom of the hip bone, boom, right there is your gluteus medius. Now, if you go further down, you'll feel another bump. That's part of your femur. We're not trying to massage part of your femur because that's not going to feel good either. So you're going in between. Here's the top of your iliac crest or your hip bone and the bottom. You're going to go from the bottom of the iliac crest or your hip bone to the top of the femur. It's actually the greater trochanter, but we're just going to call it the femur for today. You're staying in this area. So you're going to take the racquetball, you're going to put it in a spot, and you can kind of roll it around a little bit with your hands so you can find that spot. There's usually nice trigger points in your gluteus medius. Then once you've found one, you're going to put that on the wall, and then you can kind of lean into it. Now notice my feet are not really far away. That's a lot of pressure, ow, and that's really, really painful. I don't like that at all. So my feet are 6 inches from the wall, but I'm going to lean into that just a little bit, find that trigger point again, and then I'm just going to kind of do a little wiggle. Little back and forth. You can also do a little up and down, like a little baby squat kind of thing, but I like to do a little wiggle back and forth, and man, that is just really getting that trigger point. Now, I will say in the gluteus medius, trigger points tend to be pretty significant, and it usually takes a minute or two to get them to melt. And how you know that they've melted is that it doesn't feel as sharp. So many people ask me, like, how long should I do it for? Well, you should do it until it melts. How do you know if it melts? It's not quite as sharp. It will usually turn from sharp pain to kind of a bruise type pain. Then at that point, you know that the trigger point has melted. You've got blood flow to that area. Then we want to leave it alone for a little bit and let it heal. Okay, now when we're talking about knee pain, we don't want to forget about the calf, because that gastrocnemius, or that calf muscle, does cross that knee joint. So it can also be causing some of that pain. So if you want to use the racquetball for this one, you're going to, again, flat palm it, because I feel like that's going to be easier. And then you can roll it over the gastroc until I don't know if you guys can see it, but it's actually like flipping over there. There's a nice big trigger point right there. And then I'm gonna apply a little bit of pressure and do some little circles. Again, you can do the back and forth, you can do the up and down. For me, I feel like the little circles are working really well here, so that's what I'm gonna do until that trigger point melts. However, for me, the stick still wins when we're doing the calf because, again, these are nice long muscles and I feel like I can cover more ground quicker. So I'm gonna bring it behind here and just go up and down along that muscle belly until I find another nice trigger point, and then I can stay up in there and just go back and forth like that. Now, if you want to use your hands with this one, what I do tend to do is have thumbs on the back, fingers on the front, and again, I'll run my thumbs down the back of my calf. Oh, that's a nice spot right there, right over my Achilles tendon. Oh yeah, that's definitely a good one. And then you can kind of move over and run your thumbs down there. If you find that nice trigger point, again, I like to use the fingers and just find some pressure. There we go. This can be a little bit more helpful because sometimes calves have trigger points that are kind of on the front part of the calf, whereas the racquetball has to go through the calf to get to that. Sometimes the fingers can kind of dig in a little bit. If you feel like you're not completely able to get it with the racquetball, you might try coming at it from more the front part of the calf and dig in there a little bit. That's a really nice spot right there. And again, I'm gonna make sure that that area has enough pressure until that trigger point melts, and then I'll go ahead and move on to another area. Now, with your foot elevated on top of something, one, it makes it easier for your back to get to it, which is one reason why I like to do it, so you don't have to be bending all the way over. But the other thing too is that puts that calf in an already shortened position, so you're already ready for that trigger point release. All right, so there it is. If you want to eliminate your knee pain, how you can do some self-massage using multiple different tools. Try the different ones, see which ones work best for you. As you saw, the stick is generally my favorite, especially when it comes to legs. And I'm going to drop a link below if you're interested in checking it out. If you've been looking for a massage gun, I cannot recommend the Theragun high enough. Again, the ergonomic design I feel like makes it much easier. Plus the Theragun is easier to use on things like the upper extremities where I wouldn't use the stick. So I'm going to drop a link in the comments below. But now it's over to you. What is your favorite tool to use to massage your legs in particular, and why is that one your favorite? And yes, I understand if it's a foam roller, you're going to have comments about what I said in here. Again, my personal experience is the foam roller causes more pain than it actually benefits, but I'd love to hear your feedback.